Hello, everyone. Welcome. We'll give everyone a couple minutes just to join us. Okay, it's about 6:02. We'll give it another minute and then we will begin. Again, welcome.
You're good to go, Dr. Sean.
Perfect. Okay. Good evening, everyone, and welcome. Thank you so much for joining us. I am Shawn Smith. I am one of our board members for Birthing the Magic Collaborative. I'm also a pediatrician. I am in Chicago, Illinois. I work at Northwestern Feinberg School of Medicine as well as Lurie Children's Hospital. And I've been on this board now for a little over a year, maybe a year and a half now, and have enjoyed bringing these sessions to you all, taking out the middleman, bringing the physicians, the researchers, the doulas, the educators to you to be able to give you information straight from the source. And I'm so excited to welcome two of my own colleagues also here in Chicago with me this evening. And so I will do a little bio. The C&E credits have been put in the chat as well as on the screens before, and that'll be shown throughout as well. So we're going to have two presentations this evening. First is going to be Dr. Audrey Brewer. Dr. Brewer is an assistant professor of pediatrics, specifically advanced general pediatrics and primary care. She got her BA from University of Michigan. Since they won, I'll say go blue. Her MD, we'll get to yours too. Dr. Latimer also has a go blue. She got her MD from University of Chicago, her MPH from Northwestern, and she did her residency at University of Illinois, Chicago, in pediatrics, and then she did a postdoc fellow at Lurie Children's in general pediatrics. She is a pediatrician and researcher in the Department of Pediatrics at Lurie Children's and Northwestern. She also has 10 years of experience prior to working in academia at a FQHC, which is a federally qualified healthcare center. Her research interests involve around the relationship between pediatric chronic medical conditions and adversities experienced during early childhood, and understanding factors that contribute to child and family resilience despite social and environmental adversities that impact health outcomes over the life course. And Dr. Brewer is going to be discussing vaccines with us today. I'm going to also introduce Dr. Latimer as well, so they can both give their presentations, and we'll save time at the end for questions, or you can pop your questions in the chat and we'll take those at the end. Dr. Tamitra Latimer is also here in Chicago with me. She is also a pediatrician. She is the interim chief of advanced general pediatrics and primary care in the Department of Pediatrics. She's an assistant professor. And also, she got her bachelor's at Cornell University, her MD at University of Michigan. There's your Go Blue. She did her pediatric residency at University of Chicago, Cromer Children's Hospital, and was also a resident at, got that already. She also has interest in adolescent reproductive health and electronic medical records. So I'm so excited to welcome them both this evening. And Dr. Brewer, I'll have you take it away first, followed by Dr. Latimer, and then we will have questions for both. Dr. Latimer is going to be talking about all the testing that we do in the newborn nursery or in the NICU before when babies are born before they go home. So lots of information. There's lots of things going on. So you're going to hear some great information, and we welcome your questions. Welcome to both of you.
Great. Well, thank you so much. I'm looking in the chat and I see there's a lot of people from all across the country. I think there's someone from DC. I'll be in DC this coming weekend. So I'm excited for that. So I am really excited to talk about vaccines. So let me go ahead and share my screen if you can just bear with me. All right. Okay. All right. Okay. So as I mentioned, I will be talking about vaccinations and the importance of vaccines and the recommendations that have been laid out and that we in pediatrics we typically follow. Right. So as I mentioned, there are some recommendations that we as pediatricians are following, and these recommendations have been laid out by the American Academy of Pediatrics to really help and support all children and their well-being. The AAP, so the American Academy of Pediatrics, has a specific schedule that is providing a lot of kids the recommended and ideal timing of all types of vaccines. And this guidance has been really important and been instrumental in helping support kids thrive. The AAP has considered the ideal timing for healthy kids and children based on lots of studies that have looked at what's going to be ideal for a child's immune system and helping kids and protecting them as best as possible. So whenever a kid is vaccinated for diseases, we think about the timing of those vaccines. There's been lots of studies that have looked at what timing is going to be ideal to protect kids. And so this research has been well studied for many decades to really help and support a lot of our kids and protecting our communities as well. So, one question that we often get from parents is in regards to how often, does my child really need these vaccines? And why are there specific times for the vaccinations that we are giving? A vaccine is typically given, a lot of vaccines are given in one or more doses, and the timing of each of these doses is really kind of dependent on a number of different factors. A lot of these factors are related to a child's age and when it's really optimal to protect a child's immune system. So, at what age is the immune system really going to be working really hard to help and protect these kids? And so that's why a lot of kids are given vaccines at such an early age as well, because these are optimal times to ensure that we are protecting these kids early in life so that their bodies can adapt and grow. And then also, a lot of times we give these vaccines at early stages in a child's life because we know this is when they're most vulnerable to serious infections and their highest risk for disease. There's many vaccines that are given annually. So, for example, like the flu shot, and that's one. But there's some vaccines that offer more lifelong protection. And so some of these vaccines are typically only given maybe in one or two doses that are spread out over months or maybe even sometimes over years. And so there's differences. And because of that, I know there can be some confusion on why certain vaccines are given more often than others, but there's been a lot of studies that have shown the effectiveness of certain vaccines being given annually to make sure that we are protecting our kids and they're building up a more immune response to protect them from serious infections. Some vaccines can differ, like I mentioned, in terms of the timing of when they're given. And then there's some vaccines that we often have to be careful with for certain kids based on their medical conditions and why we oftentimes will delay, or sometimes these kids are not even able to receive those vaccines because of specific medical conditions based on factors related to their immune system, if they have a weakened immune system, or if there's specific medications or different chronic diseases that they may have. And so that oftentimes can really sideline when a kid might get a vaccine, but also if that kid will actually even receive that vaccine. So another key question that we often hear are, can vaccines be spread out over a longer period of time? I know it can be really hard to think about when, your child is getting like four shots, four pokes in one visit. And so that can be pretty scary, right? So we know that a lot of these vaccines are really effective when they work together. And so giving many of these vaccines together really can help to boost and support a child's immune system so that their immune system can be stronger. Now, there's been a lot of studies that have really helped to develop a lot of these new vaccines, so where we're not doing a lot of pokes anymore. So that's been really helpful, and so then we can combine a lot of these vaccines together into one or two pokes. And so for several reasons, that's why I mentioned that we have to give a lot of these vaccines together to really help and support a child's immune system. So the pace of them, the time we give these vaccines is super important. We oftentimes think about when it's really important to give these vaccines early instead of waiting, because we know that a lot of kids, like I mentioned before, when they're really, really young, they're more likely to get serious infections if they do actually contract those particular infections. Um, and then, in addition to that, the AP has really thought strategically and really put a lot of time and effort into developing a timeline for vaccines that really is designed with the child in mind and thinking about when it's really important to protect these kids, thinking about the timing of these different vaccines to really help and support kids and prevent different diseases. Another key question we think about oftentimes um, is related to that timing as well, and why we think about like multiple vaccines. So parents often think about, what if my baby maybe missed a shot, or what if they are behind a shot? Will this delay them getting the protection that they need, or do they have to start over with all of the vaccines that maybe they did get, but they didn't come in for specific shots? Not to worry in terms of like if your child might have missed, or if you know of a child that might have missed a couple of shots at a certain age, they don't have to take all of those shots that they got prior to missing all of those vaccines they may have missed before. They don't have to restart the schedule. And so the idea is we want to still make sure that they're getting the shots that they need. They just don't have to restart and take all of the additional shots that they may have gotten before, but then missed a couple of shots down the road. And so that's why, it's really important to also talk with your child's pediatrician to make sure that you have a good understanding of when specific shots are given. And then also what the catch-up schedule, that's oftentimes what we think about when kids miss shots, what that catch-up schedule looks like. And so we know that giving multiple shots will definitely support our immune system. It's not going to overwhelm a child's immune system. It's not going to overwhelm them. And it will help to protect them and make sure that they are safe and they are protected. And so, like I mentioned before, there's been a lot of work that is really studied to make sure that all of these vaccines are doing their job right to protect kids. Now, another question often that I might hear is, why are kids still needing all these vaccines? I thought a lot of these diseases are mostly gone. I don't really hear about polio. I don't really hear about the whooping cough that much. Why are we still giving all these vaccines? Well, a big thing is that a lot of these infections are still actually around, but we don't necessarily always hear about them. The only infection or only disease that we know has been eradicated is smallpox because of complete vaccination for that. But there's a lot of different diseases out there, for example, like measles, and we've heard of different outbreaks of measles recently. And so a lot of these different infections are still around, but not a lot of people get them. But at the same time, because they're still around, it still puts a lot of us in danger, puts our kids, especially in potentially in danger from getting different infections. And we don't know how some kids may respond to getting in contact with different diseases. And so we want to make sure that all of our kids are protected as best as possible, and making sure that we're preventing outbreaks as best as possible. So with that being said, as I mentioned, there are some diseases that are still around, but we oftentimes may not necessarily always hear about them. But a big part of why we do hear about different outbreaks is because it has a lot to do with community immunity. Community immunity. That's a tongue tie. So what is community immunity? Well, community immunity is when most people in the community have immunity to a disease. And so that means that disease is less likely to spread when more people are getting vaccinated. And we see that oftentimes with a lot of different types of diseases. That helps to prevent people that may be more vulnerable and maybe aren't unable to get vaccinated. Oftentimes that helps to protect them as well. And so it's really important as we think about vaccinations, why we want to support community immunity, because we, like I mentioned before, we really can't predict how different diseases might impact kids, how it might impact other people that have that are unable to get vaccinated as well. So we want to make sure we're using all the tools in our arsenal to protect and make sure that kids are thriving and doing their very best. When we think about vaccines, we also have to think about um, what vaccines might do to kids in different settings, and sometimes parents get worried, like, what if my kid is sick? Will that really, if I give my kid a vaccine, will that make them sicker? Will their symptoms get worse? Oftentimes, when kids have mild illnesses, whether they have a low grade fever, maybe a cough, an earache, or a runny nose, it's pretty safe to give kids the vaccines. And even kids who might have diarrhea or vomiting, it's still pretty safe to give your kid a vaccine. But it is something that you still want to talk to your child's pediatrician about. I always think that's really important. You and your child's pediatrician can make informed decisions together on whether you want to delay giving a vaccine until your child is feeling better or go ahead and give your child the vaccine. So all that to say, it's still pretty safe when a child is not always necessarily feeling their very best to give vaccines. But there are some times when if our kids are feeling really, really sick, that we try to avoid giving vaccines. Another key question that oftentimes comes up, can you get a disease from a vaccine? And this is a very, frequent question, like I mentioned. A vaccine does not cause disease in healthy people. If the virus or the bacteria is used as that key ingredient for the vaccine, it is either not alive or it is very, very weak to cause any type of infection. And vaccines sometimes will have these different active ingredients that is really helping to inform our child's immune system to build up a key response to in the future to fight off different diseases. And that's known as antibodies. So just like a child is learning to read, we think about our immune system as somewhat doing the same thing, as learning and studying that information that the vaccine is providing about that specific disease, so that the child, if they ever do come in contact with a specific disease, they can be well prepared to fight off, their immune system can fight off that infection and resist the disease. So that's really important when we think about what the viruses are doing, what the vaccines are doing, and how they're really helping to support kids to grow and thrive. There are some vaccines that we are using that are considered what we say live vaccines, but these are weakened viruses. Typically, those are the live vaccines that we're using. And this type of vaccine rarely ever causes an infection. And so that's something to consider as well when we're thinking about when we should be giving some of these live vaccines. So we tend to wait on giving those particular vaccines at a later age in a child's life. And then in some cases, if kids have weakened immune systems for different chronic medical conditions, or if they're taking specific medications that weaken their immune system, oftentimes we will forego giving those live vaccines. So this is another big question that comes up often. Do vaccines cause autism? And people have been really concerned about some of the information that comes out about vaccines and autism. A lot of that comes from the fact that what we know is that oftentimes kids are getting many vaccines between the newborn period and the age of 2. And we also know that during the same time period, many kids might start showing signs of autism. And so that's where I think sometimes people get concerned. Is it one thing causing the other? But there's been lots of research, medical researchers have studied this for over 25 years that have determined that one does not cause the other. One is not linked to the other. So vaccines have not been known and shown to be linked to autism. Another big key question that comes up is what type of side effects do we might see? So just like medications that we might take, any medications we might take, even over-the-counter medications, sometimes there can be some rare side effects. We do know that. Oftentimes, the most common side effects are mild side effects, such as redness or swelling or pain at the injection site. Those symptoms are pretty typical. They can be mild. They typically will go away within a day. Those are things that we oftentimes think of. But of course, if these symptoms last for longer periods of time, that's something that we really would want a kid to come in for to be examined to make sure we're not missing anything else. There at times are very rarely causing severe allergic reactions. However, these allergic reactions are far less serious than if a child were to actually get the actual disease. So the benefits outweigh the potential serious reactions, and so that's why we always think it's really safe to give vaccines overall. All right. So just kind of summarizing everything up, we know that many parents and other caregivers, they know what's best for their children. We know that it's really important to make sure that all of our kids are feeling safe, they're able to thrive, and they're able to be their very best. As the pediatricians, they can provide a lot of great scientific information. They have a lot of training and knowledge to help support thriving and growing kids. And so when parents and caregivers are working together with pediatricians to make sure that kids are growing and thriving well, making informed decisions about what's going to be best to help and support a kid's growing immune system, that can be the best thing that we can do to really make sure kids are protected and we know that they're able to thrive and be their very best. And I look forward to any questions that you have on this topic. I think this is a really important topic, and sometimes there can be a lot of information out there that we're trying to digest. And so I hope this presentation has helped to support getting some accurate information. Thank you.
Thank you so much, Dr. Brewer. I
No
know there's
problem.
already been some questions in the chat, and I know Marie from Birthing the Magic is already fact checking and answering some
Mm.
questions in there. So we will go right ahead into Dr. Latimer's, and then we will do combined questions for both. So if you all have
Sure.
questions, please pop them in the chat. Well, actually, let's see. You know what? Why don't we while we're putting out, why don't we just go through these while we're waiting? Why don't we do that? Okay, because I sometimes when you're thinking about one thing, so let's do that. Okay, I just want to make because you did great on time. Thank you so much. Okay. So for those who may not be able to read the chat, spreading out the vaccines isn't ideal. It leaves children vulnerable to preventable diseases. So thank you for that. Crystal Russell said, I've heard a lot about Black males not being able to process heavy metals in vaccines. Are there any studies on that? Marie from Birthing the Magic says, the idea that Black males have a biological inability to process heavy metals in vaccines is not supported by medical or scientific research. Where there are legitimate and serious reasons for medical mistrust in the Black community, this specific claim is considered misinformation.
Can I,
Um,
can I chime in too? That that the vaccines don't have heavy metals. Dimersal, which is like a preservative to keep the vaccine safe and stable, and also um, ethyl mercury, but it's not the mercury that we're thinking of. These are not considered heavy metals and they're very easily cleared from the body. And so this is not a concern that we have in vaccines, that there's heavy metals.
Thank you, Dr. Latimer. And then there's a question again from Crystal Russell. As of January 26th, there is a new schedule. The number went down from 11 to 11 from 17. Is this still effective? And then Birthing to Magic, Marie says, actually, no, the AAP does not recommend this adjusted schedule. And I will say, be careful where you're reading and getting your information from. And then she states the AAP has taken the rare step of publicly breaking with the CDC over this.
Yeah, and to add to that, because on the AP's website, they mentioned that over 200 medical organizations have partnered with the AAP on these specific recommendations. And so all of these different organizations have broken from what the CDC has made recommendations for vaccinations. So that's a rare, thing that has happened and transpired over this past year. But our recommendations were what the guidelines were previously from the CDC that they had recommended, but are no longer doing.
And
Yeah. Go ahead.
that the AAP has a web on their website. They have the vaccination schedule that you can check yourself, and you can, and I believe it's the .aap.immunize. Like,
E-
put in, if you even Google AAP
Yes,
immunize, then you'll be able to see it, and you can compare and see that it is the exact same schedule that was previously offered via the CDC.
yeah, yes,
Mhm. Yeah, so just be careful. So many websites that we would normally share and were trusted sources of information and research, unfortunately, just are not in this current administration. They just are not. So the AAP, the American Academy of Pediatrics, are what we are all as physicians following. There's one more question in here from Tanya Fielder. Can an adult still get one of these diseases if they did not receive vaccines as a child?
yes, that is definitely possible. What I forgot to mention too with this outbreak of measles, a lot of the people that have gotten measles are people that have never gotten the vaccinations. So those are the ones that we're more than often seeing that are part of these outbreaks. And then something else to keep in mind too, as adults, even though this wasn't part of the topic, but there are certain vaccines that we should get updated. There's
Mhm.
some that are like every 10 years or so. So that's that what we call Tdap. So the tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. So that's something we definitely, want to make sure that we're protecting ourselves because we can still get pretty sick from a lot of these different diseases as adults.
And I'll go out on a limb that say that probably neither of us, Dr. Brewer, Dr. Latimer, Dr. Smith, I never saw measles as a training
Mhm.
physician.
Yeah.
It wasn't around. No one got it. My mother
Yeah.
had it as a child. It
Mhm.
was like it was like our chicken pox, right? So my generation, we all had chicken pox, and now there's a vaccine for chicken pox. Now kids are not getting chicken pox. So the
Mhm.
fact that we are now seeing measles, like we had to oh, is that what it looks like in person? Because
Yeah.
it had been eradicated or almost eradicated. And so
Mhm.
now with the fear of vaccines and autism, and I get that it's a legit fear, but the
Yeah.
misinformation is now causing our children who are otherwise healthy to be sick. There's one more question in the chat.
Mhm.
Make sure I didn't lose it. Oh, to the autism slide. What is a good way to, this is from Lisa Rafferty. What is a good way to respond to someone who strongly believes that vaccines are tied to autism?
Yeah, I mean, that's such a great question. And um, it can be tough because there's so much, like Dr. Smith mentioned, there's so much information out there that is causing a lot of confusion in different spaces on social media. And I don't necessarily think there's necessarily one wrong or right way to respond to parents. And you just try to meet parents where they are with their concerns and empathize with where they are with these concerns and share with them that there was maybe one study or one researcher that had linked autism to vaccines or vaccines to autism. But of comparatively to all of these other researchers that have and studied over quite a few different decades, they have found that that link is not accurate, and that the data was not accurate as well. And just sharing with them about like some of that information that I shared, and also, like I mentioned, empathizing with them about it, but that because of decades worth of a lot of time and energy into rigorous research, there has never been shown to be a link between vaccines and causing autism. We're still learning about potential causes of autism. So that's been really important. There's a lot of investigators that take care of a lot of kids with autism that are really wanting to study more what potential causes could be linked to autism. And so it's still unclear exactly. There may be certain things that might be linked, but they're still trying to learn more about that. And so that's typically how I try to share with parents and coming, like I said, from an empathetic and understanding place with them. And you may find that there are some parents that just are going to have hard lines on no vaccines. And you try to support them in those decisions as best as you possibly can, but and also sharing with them too about making sure that our kids are thriving and that we're decreasing their risk from really serious diseases that we wouldn't want them to contract. And so that's usually like how I try to share with families as best as possible. And like I said, some families they may have a hard line on their feelings around vaccines, and you support them as best as you can within that, but making sure that they have the right, most accurate information with in hand when they leave your office.
Awesome. Okay, that's perfect timing. We got through the vaccine questions. You can still put questions in because if we have time at the end of Dr. Latimer's, we can definitely still answer some vaccine questions as well. But now we will go on to the newborn screening presentation by Dr. Latimer.
Dr. Brewer, would you mind advancing my slides?
No, I do not mind. Let me go ahead and get all of this ready. And Dr. Latimer, you can see the screen.
I can.
Okay, great.
Thank you.
Mhm.
So, good evening. Welcome. I'm really glad to be here. Today, we're going to be talking about the very first medical decisions that parents need to make in the newborn period. And like vitamin K, erythromycin, eye ointment, and hepatitis B, just to name a few. And uh, how families are having to sift through a lot of information, as Dr. Brewer has mentioned, and coming from social media, from podcasts, the community, grandmothers, uh, and how this can be very conflicting and thus confusing. And hopefully, we'll walk you through what decades of research, science, and clinical experience related to the newborn preventive care uh, has shown and help with building confidence to ask questions and thus really make the best decisions for our newborns. Next slide. So newborn genetic and metabolic screening, what is it? It is what it screens for is certain diseases and conditions like metabolic conditions, PKU or phenylketonuria, maple syrup urine disease, hormonal or endocrine disorders like congenital hypothyroidism or congenital adrenal hyperplasia, and hemoglobin disorders, sickle cell disease, to name a few. In fact, Illinois screens over 50 genetic and metabolic disorders. What it matters or why is it important is early detection and treatment can help stop serious conditions from causing long-term damage. And oftentimes the newborn is delivered and is thriving and looks healthy, and you cannot tell that they have a genetic or metabolic disorder. How it's done is a heel prick that collects a few drops of blood that's placed on a filter paper, and then it's sent to the lab for analysis along with other newborns that were born on that day, and it's processed, and it takes about 10 to 14 days to get the results. This test, the screening, needs to take place when the infant is at least 24 hours old. So, what are some concerns that parents have expressed on why they won't they don't want this testing done. Some families have stated that, well, these diseases don't run in the family. There's nothing going on in our family. We don't have any medical problems. Or families might say, oh, my baby looks really, really healthy. I don't want this screen, or I don't want my baby to be harmed or have pain. And so these are concerns that really need to be addressed. And the most important point is a newborn can look really, really healthy, but still have a metabolic or endocrine or hemoglobin problem that will go undiagnosed. And with respect to the pain, the benefits of early detection outweigh the very, very brief period of this heel prick. Next slide. Hearing tests. There are two tests, the automated auditory brainstem response, or AABR, or the otoacoustic emission test, OAE. And the AABR, or auditory brainstem response, is a test that checks how the baby's auditory nerve or hearing nerve and the brain respond to sound. So this is a picture of a newborn that's getting this AABR, and small earphones play soft clicking noise sounds in the baby's ears, and tiny sensors on the baby's head measure the response. Babies need to be asleep for this test. And this test has a very, very high sensitivity rate, and it has a very low false positive, and it's very safe and effective and causes no harm. The otoacoustic emissions test is a hearing test that checks how well the inner ear is working. A small, soft probe is placed into the newborn's ear canal and plays quiet sounds. The probe measures the echo that comes back from the inner ear. And babies can be awake for this test, the OAE, but they need to be still and quiet. Both tests are very important, and you can do one or the other. And it's very important that this test be done in the newborn nursery. And some of the reasons why families have declined this test are that they're concerned that it might cause pain, but it does not. Or they may say, well, my baby can hear just fine. They startle, they respond to, noises that I make. And the most important point about that is babies may have this startle reflex, but still have trouble hearing well enough to learn the spoken language. So identification early can lead to additional tests and intervention that can help the newborn, which will grow up to be a toddler and then a young child, to do well and be able to hear and learn and speak. Next slide. Critical congenital heart disease. It's a severe life-threatening heart defect that affects 2 in 1,000 newborns. What entails regarding the screening involves a pulse oximetry test, which measures the oxygen level in the blood using this pulse oximetry, this little sensor that's placed on an infant's foot, either the right or the left, and then the right hand. And then the pulse oximetry sensor measures the oxygen in those different body parts. And if there's a 3% difference, so let's say the right hand is 100% and the right foot is 96, more than 3%, then that is a concern that maybe something's going on in the heart, and that would warrant further investigation, like an echo or an ultrasound of the heart. This test, the screening test, needs to be performed within 24 hours of life to avoid false positives. Next slide. Erythromycin eye ointment. So this is applied to prevent ophthalmia neonatorum, which causes red eyes, swollen eyelids, and thick discharge. This is to be distinguished from the really common blocked tear duct that we can see that also causes discharge from the eye. And sometimes it can be yellow, like this picture, but it doesn't cause the eyes to be red. So the white part of the eye, it does not cause the white part of the eye to be red. And there are no swollen eyelids in a blocked tear duct. And most importantly, with this ophthalmia neonatorum, if untreated, it can lead to blindness. And that's not something that we see in a blocked tear duct. Why it's important or why it matters. Erythromycin eye ointment is required by law in many U.S. states as it protects newborns even if the maternal screen for gonorrhea and chlamydia is negative, as some infections may not be detected before delivery. The erythromycin eye ointment, and it's an antibiotic eye ointment, needs to be applied the first 1 to 2 hours of life. It's quick, safe, and effective. Some parents are expressing concerns and declining this application because they're worried that the ointment itself can cause blindness, and they're also state that, hey, I don't have an STI. I don't want my baby to get this. My baby isn't at risk. And the most important point is that this eye ointment, it's an antibiotic. It does not cause any harm, and it's universal in preventing this ophthalmia neonatorum. And by giving it to every baby, no matter the history and universally, shortly after birth, it really does decrease this bias, and it makes sure that babies are protected from a really terrible but preventable disease. Next slide. Vitamin K injection. What are we preventing? Vitamin K deficiency bleeding, which can cause serious internal bleeding, including in the brain. And why is it important? Newborns have low vitamin K levels at birth because their gut is immature. So in the gut is where vitamin K is produced, and bleeding can occur suddenly and without warning. And what happens is a single vitamin K injection is given after birth within the first few hours of life. This is safe, effective, and considered standard of care. The prevalence of parents expressing concern and thus declining this vitamin K injection is increasing. It's on the rise. Many families have expressed concern. Well, my other baby didn't get this and they were fine. Or I really want to avoid my baby getting a shot because I don't want them to be in pain, or it can cause cancer. This is something another thing that families have expressed. In a study, some families have said that they find it is unnecessary and they would like it to be a natural process, and that they would prefer that this vitamin K protection be given orally. Unfortunately, there's no vitamin K that's available oral, and the vitamin K oral is not effective. So it needs to be given as an injection. This vitamin K is very, very safe. It's not been associated with any cancers, and it's considered the standard of care. And again, this vitamin K deficiency bleeding is something that can be prevented. Next slide. Jaundice in the newborn. What is it? It's yellowing of the skin and eyes in the newborn. Please see this picture here, caused by a buildup of bilirubin in the blood. And it's common in the first few days of life as the liver matures, and that's a common theme. The newborn is is very young and very immature. And as the organs wake up, they are very vulnerable. And that's why it's very important during the first 2 or 3 days that we do our best to support and protect the newborn. Jaundice, why does it matter? In most cases, it's mild and harmless. However, if levels get too high and go untreated, there's a risk of brain damage. And what we do to monitor and check on the level of jaundice in the newborn period is to obtain bilirubin levels before discharge. Sometimes we'll check these bilirubin levels multiple times, depending on if there's risk factors or if there's earlier concern. And we check these bilirubin levels with a probe or transcutaneous bilirubin versus a blood test or a serum blood test. And sometimes at discharge, they might need at follow-up, the follow-up visit with the pediatrician, they might need to repeat these bilirubin tests. If treatment is needed, then it's with phototherapy, which is a blue light that helps break down bilirubin. It's safe and effective. And this is a picture of a newborn that's in a crib. And you can see that they only have their diaper on and they have an eye shield. And there's phototherapy. That's what gives this blue hue. And the baby doesn't have any clothes on to allow for maximum exposure to the phototherapy with the skin. Next slide. So hepatitis B vaccine, this is a vaccine that's given in the newborn period. And Dr. Brewer did an excellent presentation talking about the importance of vaccines in children. Hepatitis B, why it matters is the hepatitis B virus can cause chronic liver disease. And many people don't even know that they're infected, and it can be passed from family or caregivers to the newborn. And the significant concern is 90% of infants that are infected at birth will go on to develop chronic infection. And what we do to protect newborns from hepatitis B and chronic liver infection or disease is to give the first hepatitis B vaccine within the first 24 hours, as recommended by the American Academy of Pediatrics. We provided that website that provides the vaccine schedule, which is identical to what the IDPH, Illinois Department of Public Health, also uses. And there's been a lot of concern about why parents have expressed concern about why they're declining this vaccine. And I think a lot of the confusion arises from the conflicting information that is coming from the administration and that what they're reading, maybe hearing about on social media. But this is a vaccine that has been around for a very, very long time, and it's been shown to be very, very effective in preventing this preventable disease, chronic liver disease in our newborns. So it's very, very safe. And some concerns that parents have expressed, again, my baby may cry. Again, the extensive and significant benefits from vaccination versus the very short, brief pain that the infant experiences after the vaccine more than outweighs that brief pain. Next slide. RSV, or respiratory syncytial virus, what is it? It's a virus that can cause difficulty breathing, coughing, and low oxygen, where the baby may turn blue and have significant problems breathing. This is a virus that, yes, we know can affect newborns and infants, but it can also affect adults. But adults, healthy adults, when they get infected with this virus, can have a cough, just usual common cold symptoms, whereas infants and newborns can become very, very sick. So, how can we protect babies? Two ways. One is the vaccine is given to pregnant people via the called the Abrezvo, and it's given at 13 to 36 weeks pregnancy during the RSV season, and these antibodies are passed on to the baby in utero. A second way to provide protection is infants can receive the antibody. It's also an injection called nirsevimab or Beyfortus, and it's given after birth during the RSV season. So from birth up until 8 months of age, and it provides immediate, long-lasting protection. Again, it's given during the RSV season, so usually around October through March. But this particular season, we've seen significantly high rates of RSV. So we're actually extending it until the end of April, that we're giving the infant the nirsevimab or the infant the RSV antibody. Next slide. And I'll end with this. This is not really a test, but this is something that is monitored in the newborn period. And it's meconium. Meconium is the baby's first stool. And I was going to have a picture, but I was like, that doesn't really look, that won't really look that good. So I left the picture off. But meconium is the baby's first stool or poop. It's described as black and very sticky, and it's passed in the first 1 to 3 days of life. And why is it important? Most babies, like 90% of babies, pass this meconium within the first 24 to 48 hours, which really shows that the baby's bowels are working, they're functioning, they're doing what they need to do. And incidentally, most infants, if they're born vaginal and the baby is feeding well, they'll be discharged at 48 hours. However, if the baby still hasn't had a bowel movement within 48 hours, has not passed meconium, then they'll keep the baby and continue to monitor until a stool has passed. If after 72 hours still no meconium, then we become very, very worried that there might be a blockage like Hirschsprung's, and further testing needs to be done. Let me also state before I end that especially for the newborn genetic metabolic screen, the hearing screen, those are all screens. And if they're abnormal, then additional testing will need to be done to support whether there is a concern. And that just really underscores the whole point that we need to be mindful that a newborn, oftentimes they come out very vigorous, but we might be missing something, and it's important that we be thoughtful about screening universally all newborns so that they are healthy and they thrive from day one. I'm happy to take any questions. Thank you.
Thank you so much, Dr. Latimer. That was awesome. I was thinking we're such visual learners. Right? We learn by pictures and seeing how it looks. And so I would have thought that too. But yes, maybe you all are eating dinner out there right now. Okay, let's check the chat. Okay, yes. So Marie from Birthing the Magic just said, yes, many parents believe that because hepatitis B is often transmitted through the blood or sexual contact, their newborn is not at risk. However, the medical community emphasizes that this virus is hardy and can survive on surfaces for up to 7 days. Universal vaccination acts as a safety net for accidental household exposure or in cases where a mother's screening was inaccurate. Yes, awesome. It was wonderful hearing you all and listening to you all. If you have questions, please pop them in the chat, and we will read them out. Okay, here is a question from Valerie L. I can't see your last name. Are all the screenings done in the room at the mom's bedside with her and or dad present?
So it's been a while since I've been in the newborn nursery. So Dr.
Oh, I've been there. Yes. Okay.
chime in.
Okay, yeah. So I work in the neonatal ICU, and so I'm down on labor and delivery often for deliveries. So I can tell you for sure that usually the vitamin K and the erythromycin drops are as soon as the baby is well, screaming, crying, vigorous. Of course, we do all the resuscitation things that we need. And if the NICU team, the PEDS team needs to, if we're no longer needed, the baby's doing well, we kind of can leave the baby safely with the labor and delivery team, then those things are done right there. So the vitamin K, which it looks like a shot, it is a poke in the thigh, and the erythromycin eye drops are done pretty immediately. But then once they're done, they're done. Then baby can go, right to mom, right there. The other things are usually done in the newborn nursery because they're usually done either at or after that 24-hour mark. And a lot of times at our hospital, what we have what's called a 24-hour bundle. So the nurses will try to do everything they need to do in that 24 hours. So they're not kind of coming back and come get your baby again for this and then that. It's how to do everything. So they do like the newborn bath, the shampoo, that's just, we don't often do that earlier because, we don't want baby's temperature to drop too low if you're all wet now. So they usually make sure that there's been no temperature issues. So after 24 hours, they'll do the bath. Then they'll do the heel prick for the newborn screen, because again, that has to be done after the 24-hour mark. Usually there's already been a conversation about the hepatitis B. That's usually the only vaccine that's done in the newborn period. So that's often done in the 24 hours. Again, you have to have consent for that. So that would not be given without your consent because that is a vaccine versus the other two that are done right at birth is a medication, the vitamin K and the erythromycin. The bilirubin screen is also, they can do a skin test. So oftentimes they might check on the baby's forehead, but it is often a heels prick too. That's the more accurate way. So they might do that also in the 24-hour bundle. And only if that level is high, they may have to check it again one more time before you're discharged. So maybe at that day 2, 48 hours, or day 3 if you were, a baby's born via C-section. The meconium, obviously, they'll be checking the stools, and if there's any so they'll ask you how many stools, how many wet diapers. So if there's no stool, then that'll be a concern. And then if you're hitting the 2-day mark, they'll call the NICU doctors in to kind of check in there. What were the other screenings? Now I just forgot them.
So I think
Oh,
you covered them. You did great.
yeah. Yeah. And the hearing
Hearing.
test is usually done after 24 hours too. Again, because sometimes there's like not meconium, amniotic fluid or some fluid in the baby's ear. And so if you kind of wait a little bit, a lot of that fluid is kind of has been removed, and then because sometimes that can interfere, and you can have where it may appear the baby may have failed a hearing test, but usually it's just some fluid in the way. So usually that's done after 24 hours too. That one, it depends. Again, the babies have to be asleep there. So I think the pediatrics folks come into the rooms and do that, but they may also try to do that in the newborn nursery, just given sometimes that it's quiet. It depends on where all the babies are. So it just has to be quiet. In the NICU, all the babies are together, so they come right to the baby's bedside. But again, if you have any concerns, again, whether there's some fear, some distrust there, which again, we absolutely understand that, just ask all your questions and don't feel nervous or scared to say, I am nervous about my baby being taken away, or I'm nervous about them being out of my eyesight, because then the nurses and the doctors can you can have better communication. So you can say, okay, I understand that you're scared. Let me explain everything to you. Or if possible, they can bring you. They are often not able to bring parents into the newborn nursery because other people's babies are there, but they might say, here's a window. You can stand right outside the window and watch, and I'll bring your baby to the window so you can see everything that I'm doing. Versus sometimes parents will just say, well, I don't want you to take my baby. And it just creates this, you know, just this interaction where if you just say, I'm nervous, I'm scared, I don't want my baby away from my bedside because I've just heard too many things. And then we can say, okay, I can deal with this fear. And let's talk through it a little bit more. Okay, more questions. Let's see. Oh, it keeps going back to the top. Okay, hold on. Let's see. Okay, thank you, Dr. Latimer, Dr. Brewer. Okay, here we go. Oh, thank you so much, Dr. Latimer. This was detailed explanation to co-sign as a birth doula to reinforce the birthing person's decision-making. Awesome. If you are doing a C-section, would the baby need the eye drops?
Yes. And I think this is really important that this be universal. This is not for someone that's vaginal delivery or someone that has a C-section or someone that is Black or someone that is white. This is for all newborns. And I believe if we had that stance that these antibiotic drops help to prevent something that's super serious and it's administered to everyone, it's universal, then we're not going to miss someone. If the standard is applicable and it's applied to everyone, then we're not going to miss one, especially when we know that not providing care or offering this or giving this to someone is so very detrimental. So it's an excellent question, but it is administered to everyone.
Okay, we're hitting up time, but I'm gonna try to get these last ones in. I've seen the heel prick done within the golden hour in the room with mom. Now, I will say, as a NICU doctor, we do sometimes have some babies who have some known congenital anomalies. So where we're at, we have a birthing hospital at Northwestern, and then right next door we have Lurie Children's Hospital. So if we have, and we have now a fetal center, so we have so many families who come not only from Chicago but from surrounding states because we have physicians who can do surgery while the baby is still inside. So we have a whole fetal center. So we have quite a few babies that are born with significant defects that as soon as they're born, they have to be whisked away to the children's hospital. Those are the only babies that I know of where we do get the newborn screen right at birth, because again, they're leaving our hospital and we can't have a baby born in our hospital and don't have that screening. They will likely get a second one over at the children's hospital, but that's the only time where we at least in our hospital do it right there. It's because of a congenital concern that baby has to go over. And again, we don't want to miss it. Next question, is it too late to get these vaccines at 1 year old? And is there another batch of vaccines that we should look out for getting one? That might be a mouthful, but there is a whole vaccine schedule, right? But no one's too late because you have, kids who are born in different countries, they may move. So when we had the immigration influx into Chicago a couple of years ago, there were children who had zero vaccines and we had to start from the beginning. They didn't have any vaccinations. And then they also had history of some diseases that we just don't see in the US because they had been eradicated. But it's never too late. You would just there, but so there's like what Dr. Brewer mentioned, there's a catch-up schedule. Dr. Brewer touched on this, but we could speak more. But could we speak a little more to this? Explain why metabolic disorders like PKU or congenital hypothyroidism are invisible at birth, and why the 24 to 40-hour window is so critical for these screenings.
Oh, I think that was me,
Yeah.
but
Oh yeah. Oh,
or
sorry.
no, PKU is a amino acid that is not the body can't break down and it gets builds up and it leads to problems and illness. And congenital hypothyroidism is the thyroid is underactive and that can lead to problems with development. And that's not something that you can tell. And it's important that you make the diagnosis sooner so that you can get the treatment. We can treat PKU and we can treat congenital hypothyroidism, giving this infant newborn the best chance to thrive and develop normally.
Okay, awesome. There's a lot of thank yous in here. Thank you for your expertise, your clarity. Have a good night. There's one last question. What is the guidance if parents want an alternative vaccine schedule?
Great question. So we would, work with the parents to develop that schedule and asking them what, and sharing with them first, what are all of the different vaccines that we do recommend, what time periods that we recommended, because there are some vaccines, especially from the newborn period to about 2 years of age, where there's specific times when we need to give it and how we need to space those vaccines out. And so working with the parents so they have a better understanding of when you can actually give the next round of specific vaccines can be really helpful when having those discussions and trying to figure out alternative schedule for vaccines. And sometimes, you may have to, depending on the child's condition, maybe have to wait a little bit longer for certain vaccines, but it can, it's a case by case basis. But I think the first thing is to share the information about when the vaccines are recommended. And so then the parents can also make some informed decisions along with your guidance on what's going to work well for them and what they think is going to work well for their child.
Excellent. I agree.
Thank you all so much. It's 7:05. We'll be
Yeah.
mindful of time, but we did get a chance to get through all of the questions. This has been recorded. Thank you all so much. And thank you to Birthing the Magic for all that you do to get this information to individuals out there. Thank you, Dr. Brewer and Dr. Latimer, for spending your evening with us and sharing this information. I had a great time with you all.
You too.
Thank you. Thank you so much.
Thank
Okay, good night, everyone.
Good night.
Bye.